When we talk about children, and especially when we talk about little children, we are trying to understand that the most important time in their life is from 0 to 3-year-old. And of course, the pregnancy time is so important for the development of the baby. But we have to remember 5 big numbers for me. One is 1 million, the second 18, the third one 3 to 1, the fourth is 90%, and the last one 6. And I want to explain a little bit about that. 1 million is the 1 million of new connections that the baby has in his neurons. Neurons, there are the brain cells. And the new connections, they are doing the job for the future, in fact. If the child has not the brain in a very good adaptation and adaptation to everything, will be very difficult for him to get a normal development when he is a child and even an adult. The second number is 18. 18 is the time where you start to have disparities in the language. This is very, very important because children that they were grows in a situation where the mother is not talking with the baby, with the family is not talking with the baby, where there is not an acceptable way to talk and to understand what is happening in the family, inside the family, probably he will not get the appropriate language skills. Of course, if the mother is well educated, of course, if the family is not in poverty, the situation for the baby will be much better. But it's very, very important to have such a contact and to try to teach the baby and to read to the baby. The next number for me that this is so important is 3 to 1. 3 to 1 is the likelihood to have disease, especially heart diseases, but not only, also diabetes, obesity, cancer, in those children that they were in front of a very hard situation during the first 3 years of life. The next number is 90. 90 is 90% the likelihood to have the neurodevelopmental problems and bad outcomes with mental health if the baby had 5 to 7 different risk factors. And the main risk factors during the first 3 years are poverty, of course, very low income family, of course, and bad education for the mother and for the father. One single family, mother or father, is also a risk factor. Of course, the issue of child abuse and not only physical but also psychological and social. They are very complicated issues, and the child is in risk. And the last number that is so important for us as pediatricians, but not only for us, but also for the country, is the capital investment. This is that if you invest in the first 3 years $1 for each child, trying to bring them in an acceptable way and to give all the necessary skills to be adapted in a very well situation to the society and to the needs of the society. For every $1 that you invest, the country will gain $6 in the future. This is that if you invest in early childhood, you will get a lot of money back from this investment. If you invest when the child is 7 to 10 or 12 year old, for each dollar you will gain about $3. But if you invest $1 in some type of recovery for young people that they having some bad situation, drugs and other problems in the society, as well people that they were in jail. For each dollar that you invest, only you will have in return $1.5. This is that invest in early childhood. This will be the best investment for the country for all over the time.
Thank you.
Thank you very much for your kindness.